Anticipate a modest increase in expenses next year, but we're remaining well under the cost growth limits. We've done this while significantly improving our quality, safety, and patient experience. We're a leapfrog top hospital. Our mortality rates have improved to the top 25% of academic health systems across the country. And I'm really delighted to say that after a ton of work, 72% of the patients discharged from our hospital are likely or highly likely to recommend Boston Medical Center. But more important, we've done this without cutting either the services the clinical service that we provide, or the programs that are part of the safety net that are very unique to Boston Medical Centers. We still provide, through philanthropy, a therapeutic food pantry for patients who identify hunger insecurity. They're given a prescription to come to our food pantry. 7,000 patients do that every month. 200 patients get a free or low-cost prescription at one of our hospital pharmacies every day. We do over 200,000 translator-assisted medical encounters. And we continue to innovate, because this system needs work, it needs change. And I'll point to one innovation. It's called Project Red. It's called the re-engineered discharge. What it does is it simplifies very complicated discharge instructions and helps reduce unnecessary hospital readmissions across the country. 300 hospitals across the country have picked up this program and have now instituted Project Red. As you can probably tell, we're very proud of the progress we made. And to the second question, we're equally worried about the challenges that significant funding cuts will pose for our institution and the patients we serve. Sequestration cuts are taking a toll on research in our organization, research into the causes of the racial and ethnic disparities that plague our healthcare system. Like everyone on this panel, we're facing significant Medicare cuts. But for us, those cuts are exacerbated by cuts to our teaching program and to the so-called disproportionate share cuts, because more than 50% of our patients are covered by Medicaid. We are, like many of the other disproportionate share hospitals in the state, we're working with the state and federal government on a waiver funding process that's literally a lifeline for us. You know, we're convinced at Boston Medical Center that running faster on the current fee-for-service reimbursement system is not in our best interest or in the best interest of our patients. Our goal is to be directly accountable for the health of the patients we serve and to be paid that way. With our partners in state government, because Mass Health is our biggest payer, they're kind of our Blue Cross. With our 14 community health center partners and with our own Boston Medical Center Health Net Insurance Plan, we want to be ready when the payment system transforms. For us and for our patients, other than taking the best possible care for them, bringing down healthcare costs is arguably the most important thing that we do. If as a community we can't bring costs into line, I believe, and we believe at BMC, that universal access will suffer. And the patients who walk through our doors every day will suffer the most. Thank you very much.
Dr. Gary Gottlieb will be next to address us. Dr. Gottlieb is the President and Chief Executive Officer of Partners Healthcare. Thank you for being with us tonight. Your organizational specific question is, over the past few years, most government reports on healthcare costs cite Partners' high prices and total medical expenditure as key drivers of high health costs in Eastern Massachusetts. Please tell us how you plan to reduce Partners' prices and expenditures over the next 3 to 5 years. Please come up.